Millions of people struggle with high blood pressure. It's a common condition. Amlodipine is a popular medication. It helps control blood pressure. Amlodipine belongs to a group of drugs called calcium channel blockers. These drugs work by relaxing blood vessels. This makes it easier for blood to flow. Amlodipine is prescribed for different conditions. These include hypertension, or high blood pressure, and angina, which is chest pain. Angina happens when the heart doesn't get enough blood. It's important to take amlodipine as directed by your doctor. Never change your dose or stop taking the medication without consulting your doctor. Imagine your blood vessels as highways. When blood pressure is high, it's like traffic jams on those highways. Amlodipine acts like a traffic controller. It eases the flow by relaxing the walls of blood vessels. This relaxation lowers the pressure inside the vessels. This makes it easier for the heart to pump blood throughout the body. Lowering blood pressure reduces the risk of serious health problems. These problems include heart attack, stroke, and kidney disease. Amlodipine's ability to relax blood vessels also helps with angina. It improves blood flow to the heart muscle. This reduces chest pain. We often think of grapefruit as a healthy fruit. However, it can be a dangerous mix with amlodipine. Grapefruit can interfere with the way your body processes this medication. This interference can lead to higher levels of amlodipine in your bloodstream. This is because grapefruit blocks an enzyme that breaks down the medication. Even small amounts of grapefruit or grapefruit juice can cause this interaction. It's crucial to avoid grapefruit products entirely while taking amlodipine. This interaction might seem strange, but it highlights the importance of understanding food and drug interactions. Let's break down the science behind this interaction. Our bodies use enzymes to break down substances. One such enzyme is called CYP3A4. It plays a key role in metabolizing amlodipine. Grapefruit contains compounds called furanocoumarins. These compounds inhibit the CYP3A4 enzyme. This means the enzyme can't break down amlodipine as effectively. As a result, more amlodipine remains in the bloodstream. This leads to an increased risk of side effects. This interaction isn't limited to just grapefruit. Some medications can also inhibit the CYP3A4 enzyme. Section 5. When medicines collide. Other drugs that don't mix well with amlodipine. Just as grapefruit can interact with amlodipine, so can other medications. It's essential to be aware of these potential interactions. Some medications can increase the levels of amlodipine in your blood. This can lead to side effects like dizziness, lightheadedness, and fainting. Other medications can decrease the effectiveness of amlodipine. This could mean your blood pressure isn't controlled as well. Always tell your doctor and pharmacist about all the medications you're taking. This includes prescription drugs, over-the-counter medications, and herbal supplements. Section 6. A dangerous cocktail. Combining amlodipine and certain heart medications. This section will delve into the potential risks and complications that can arise when these medications are taken together. Certain heart medications can interact dangerously with amlodipine. These interactions can lead to serious health issues that may require immediate medical attention. For example, combining amlodipine with beta blockers can lead to severe drops in blood pressure. This is because both medications work to lower blood pressure, and their combined effect can be too strong. Beta blockers are another type of medication used to treat high blood pressure. They are commonly prescribed for patients with heart conditions, but they must be used cautiously. They work differently than amlodipine. While amlodipine is a calcium channel blocker, beta blockers work by blocking the effects of adrenaline on your heart and blood vessels. Combining these medications can have additive effects on blood pressure. This means that the blood pressure lowering effects of both drugs can add up, leading to dangerously low blood pressure levels. This can result in symptoms like dizziness, fainting, and even heart problems. Patients may feel lightheaded or unsteady, and in severe cases it can lead to fainting or other serious complications. It's crucial to avoid this combination unless specifically directed by your doctor. Always consult your healthcare provider before making any changes to your medication regimen. Your doctor might adjust your medications or dosages if necessary. They will take into account your overall health condition and any other medications you are taking. They will carefully monitor you for any adverse effects. Regular follow-up appointments and monitoring are essential to ensure your safety and the effectiveness of your treatment plan. Section 7. Understanding the risks, from dizziness to dangerous blood pressure drops. The interactions between amlodipine and certain foods and medications can have serious consequences. One of the most common side effects is a significant drop in blood pressure. This can lead to symptoms like dizziness, lightheadedness, fainting, and even falls. In severe cases, it can even lead to heart problems. Other potential side effects include headache, flushing, and swelling in the hands or feet. These side effects are usually mild and temporary. However, if you experience any unusual or bothersome side effects, contact your doctor immediately. Section 8, Real-Life Consequences, John's Story, a cautionary tale of drug interactions. Let's consider John, a man in his late 60s, prescribed amlodipine for high blood pressure. John had been managing his condition well with the medication, and his blood pressure readings were stable. John loved starting his day with a glass of fresh grapefruit juice. It was a part of his morning routine that he looked forward to every day. He wasn't aware of the interaction between grapefruit and amlodipine. The medication instructions mentioned avoiding grapefruit, but John didn't notice this crucial detail. After a few weeks of taking amlodipine with grapefruit juice, John started feeling dizzy and lightheaded. He initially dismissed these symptoms, thinking they were just a part of aging. One morning he fainted while getting out of bed. The sudden drop in blood pressure caused him to lose consciousness momentarily. He was rushed to the hospital. The paramedics arrived quickly and provided immediate care, stabilizing him for transport. Doctors determined that the combination of grapefruit juice and amlodipine had caused a dangerous drop in his blood pressure. They explained that grapefruit juice can interfere with the enzymes that break down amlodipine, leading to higher levels of the medication in the bloodstream. John's story highlights the importance of being aware of potential drug interactions. It's a reminder that even something as seemingly harmless as fruit juice can have serious consequences when combined with certain medications. It's crucial to talk to your doctor and pharmacist about all the medications and supplements you're taking. They can provide valuable information on what to avoid and how to take your medications safely. Always read the instructions and warnings that come with your prescriptions, and don't hesitate to ask questions if something is unclear. Section 9. Navigating your health. Talking to your doctor about amlodipine interactions. Open communication with your doctor is crucial when taking any medication, especially amlodipine. Don't hesitate to ask questions and discuss any concerns you might have. Before prescribing amlodipine, tell your doctor about your medical history. Include any allergies, other medications or supplements you take, and whether you're pregnant or breastfeeding. Your doctor can provide personalized advice on managing potential interactions. They can also monitor you for any side effects. Remember, your health is a partnership between you and your healthcare providers. Section 10. Safeguarding your health. Tips for taking amlodipine safely and effectively. Amlodipine is a medication used to treat high blood pressure and chest pain. To ensure it works effectively and safely, it's important to follow some key guidelines. Here are some practical tips for taking amlodipine safely and effectively. Always follow your doctor's instructions carefully. This means taking the medication exactly as prescribed without skipping doses or taking extra. Take the prescribed dose at the same time each day. Consistency helps maintain an even level of the medication in your bloodstream, which is crucial for its effectiveness. Avoid grapefruit and grapefruit juice completely. These can interfere with how amlodipine is metabolized in your body, potentially leading to dangerous side effects. These can interact dangerously with amlodipine. It's also important to be aware of other potential interactions. Inform your doctor and pharmacist about all medications, supplements, and herbal remedies you take. This includes over-the-counter drugs and vitamins. This helps them identify potential interactions. They can then adjust your treatment plan to avoid any harmful effects. Be aware of potential side effects. Common side effects of amlodipine include swelling of the ankles or feet, fatigue, and nausea. If you experience dizziness, lightheadedness, or other unusual symptoms, contact your doctor immediately. These could be signs of a more serious reaction. Don't stop taking amlodipine abruptly without consulting your doctor. Stopping suddenly can cause a rapid increase in blood pressure, which can be dangerous. This can lead to a sudden increase in blood pressure. Always talk to your healthcare provider before making any changes to your medication regimen. They can guide you on the safest way to adjust your treatment. Section 11, Amlodipine and you, taking control of your health journey. Taking amlodipine safely and effectively involves understanding the medication, its potential interactions, and how to manage them. By being proactive and informed, you can take control of your health. Remember, knowledge is power. The more you know about your medications, the better equipped you are to manage your health effectively. By working closely with your healthcare providers and following these tips, you can safely experience the benefits of amlodipine in controlling your blood pressure and improving your overall health.